Polymyalgia rheumatica is an inflammatory disorder that causes muscle pain and stiffness, especially in the shoulders and the hips. Signs and symptoms of polymyalgia rheumatica usually begin quickly and are worse in the morning. For blood tests, beside checking your complete blood counts, your doctor will look for two indicators of inflammation: the ESR, the erythrocyte sedimentation rate, and C-reactive protein. However, in some people with polymyalgia, these tests are normal or are only slightly high. They can also use imaging tests, so increasingly ultrasound is being used to distinguish polymyalgia rheumatica from other conditions that can cause similar symptoms. MRIs can also identify other causes of shoulder pain, such as joint changes. Polymyalgia rheumatica is usually treated with a low dose of an oral corticosteroid, such as prednisone, and you'd likely start to feel relief from the pain and stiffness within the first 2 or 3 days. After the first 2 to 4 weeks of the treatment, your doctor then might begin to gradually decrease your dose, depending on your symptoms and the results of the blood tests. Because of the potential side effects, the goal is to keep you on as low a dose as possible of the steroids without triggering a relapse in your symptoms. Most people with polymyalgia rheumatica need to continue the corticosteroid treatment for 1 year or more. And the problem is that long-term use of corticosteroids can result in serious side effects, including weight gain, loss of bone density, high blood pressure, diabetes, and cataracts. Leeds researchers, using the electronic health records of nearly 40,000 people with either polymyalgia rheumatica or giant cell arthritis in England between 1997 and 2017, observed higher absolute risk of infection when patients were taking oral steroids than when they were not taking them. There was a 55% reported getting at least one infection, 26% required hospital admission, and 7% died within 7 days of the diagnosis. According to the researchers, the most common infections reported by the respondents are lower respiratory tract infections, which accounted for 27% of the infections, conjunctivitis, which was reported by 9%, and shingles, which was diagnosed in 7% of the cases. Joint pain can simply be a normal part of aging, but it can also be a possible sign of arthritis symptoms. And there's 4 major factors that are common among all patients with arthritis. These are joint swelling, joint stiffness, joint pain, and difficulty in moving or decreased joint flexibility. Of the 4 factors, pain is the most prominent symptom among arthritis patients, and it can develop into a serious problem that affects various parts of your life. The types are osteoarthritis or degenerative joint disease, rheumatoid arthritis, fibromyalgia, and polymyalgia rheumatica, which is considered less common than the other types of arthritis. But polymyalgia rheumatica involves joint pain and stiffness in large joints of the body, like the hips and the shoulders. You should check out my other video on rheumatoid arthritis for lots of supplements, herbs, and diet advice to help this condition. And also check out my other video on fibromyalgia for more similar information. Polymyalgia symptoms are linked to and worsened by a lack of sleep. Melatonin supplementation can not only improve sleep, but it can also increase growth hormone levels, and this can help speed up healing and relieve arthritic pains. You can check out my other video on herbs to help sleeping for more information about this. Other rheumatic disorders, such as rheumatoid arthritis, are associated with an increased risk of depression, which may adversely affect the outcome. The long-term nature of polymyalgia rheumatica, its associated disability and treatment with steroids means that polymyalgia patients may be at an increased risk of depression. There's some natural ways to help deal with the depression, such as ensuring that you have sufficient sleep, reducing inflammation with natural anti-inflammatories such as curcumin and boswellia, and eating an anti-inflammatory diet, decreasing the toxic burden on your body with antioxidants and glutathione, increasing neurotransmitters with precursors such as tryptophan, melatonin, theanine, and choline, taking herbal antidepressant compounds such as St. John's wort, posinol, and albizia. Findings show that omega-3 fatty acids may help lower blood pressure. They can help reverse immune system responses to inflammation, and they can protect against a recurrence of polymyalgia rheumatica. They can also help with the depression-related effects of the polymyalgia. Typical doses are 3 to 9 grams per day of an EPA/DHA molecularly distilled fish oil blend. If you're on steroid treatment for polymyalgia rheumatica, you're at an increased risk of osteoporosis fractures and bone damage. You should get a 25-hydroxy vitamin D blood test and then supplement accordingly to correct any deficiency with vitamin D3. Vitamin D3 works synergistically with vitamin K2, and most people are deficient in this also. The maximum amount of vitamin K2 that your body can absorb in a day is 300 micrograms. Therefore, supplementing with any more than this is not necessary. As calcium is also recommended with vitamin D3 and K2, you should note that due to the acidic nature of pasteurized dairy, it may be bad for your health and worsen your condition. Therefore, in order to obtain your calcium, you should eat calcium-rich vegetables, and if consuming dairy, make sure that it's unpasteurized milk, which will not have denatured proteins and will contain an abundance of enzymes and probiotics that can help to boost your overall health. You can see my other video on joint health to learn about more herbs and supplements that can help with sore and damaged joints that may accompany polymyalgia. Supplements such as collagen, hyaluronic acid, and MSM. Boost your body's own steroid production and regulation. Natural steroids can help fight inflammation, control the body's metabolism, and also promote good sleep. Supplements of vitamin C and vitamin B are known to help the body produce and regulate steroid hormones. The best form of vitamin C is liposomal vitamin C. You can learn how to make this cheaply and easily in an ultrasonic cleaner. The next best form of vitamin C is a non-acidic buffered vitamin C, with the worst kind being a cheap, acidic ascorbic acid. Vitamin C's action is enhanced when taken with bioflavonoids. Cholesterol is required by your body for the production of its hormones. Therefore, coconut oil, avocado, butter, and animal fats would be advised. Iodine is also necessary for hormone production in your body, and iodine levels are low, especially in people with hypothyroidism, which has been linked to conditions like fibromyalgia. Therefore, supplementing with nascent iodine may help boost thyroid production improving symptoms of fatigue and boosting natural steroid production. Also, controversially, people take pregnenolone in doses of 50 to 100 milligrams per day, as it's a precursor to all the other hormones in the body. I've seen massive benefits to a patient who was suffering with a severe case of polymyalgia, who started consuming 1 to 2 grams of deer antler velvet each day, in combination with some B vitamins and adaptogenic herbs. Adaptogenic herbs are said to balance any imbalances that the body is facing. Some of these herbs are Panax ginseng, Eleutherococcus ginseng, Schisandra, ashwagandha, and tulsi. Licorice is another adaptogen. Whole licorice is an effective treatment of the inflammatory disorders like polymyalgia rheumatica. It's considered as one of the top 3 herbs in treating polymyalgia naturally. Root capsules are available and they can be taken in doses of 5 to 6 grams per day. A concentrated extract can be taken at 250 to 500 milligrams per day. The intake of licorice capsules can lower the reliance of a patient to prednisone or steroid drugs. There is some concern over licorice and raising blood pressure. However, a deglycerated form of licorice can be taken to avoid this, or else you can monitor your blood pressure or just take licorice for a short period of time. Turmeric tea has a strong anti-inflammatory property. It can ease inflammation in polymyalgia rheumatica. It's also effective in easing the swelling of affected joints. A compound in turmeric known as curcumin is effective in reducing the pain caused by polymyalgia, as well as in patients with osteoarthritis. Another wonder of turmeric is its ability to strengthen your immune system, even in people with an immune disorder. Doses of curcumin can range from 2 to 5 grams per day. Its poor bioavailability can be increased by consuming it with biopterin, which is a black pepper extract, or taking it with fish oil, coconut oil, butter, or ghee. From the same family as turmeric, you have another root, ginger. Ginger can relieve polymyalgia naturally too. Consuming ginger reduces inflammation, eventually relieving even the pain caused by an inflammatory disorder such as polymyalgia. A small amount of ginger is said to be more effective than prescribed painkillers. Ginger contains gingerol that targets pain pathways, but also relieves inflammation that causes pain. Ginger can be taken as a tea or added to numerous recipes. There are many ways that you can help to relieve your symptoms of polymyalgia. You can check out my video on arthritis and my video on joints to learn how to ease pain and to heal any damage faster. You can adopt a sugar-free, antioxidant-rich, anti-inflammatory diet to help your body heal. You can check out my video on sleep to find easy ways to help you rest and recover. You can add some omega-3s, adaptogenic herbs, and mood-boosting herbs to help increase your optimism and thus reduce your stress levels. You can try to supply your body with the nutrients that it needs to make its own steroids, such as cholesterol, iodine, and controversially pregnenolone. You can make sure that you correct any nutrient deficiencies, such as magnesium, zinc, vitamin D, and also take a multivitamin and trace multimineral. You can try to replace your prescription steroids with safe, natural alternatives that don't come with the same strong side effects that these drugs do. You can try probiotics and trace minerals to help naturally balance your immune system. And be sure to watch my big presentations on the natural treatment of fibromyalgia and on the natural treatment of chronic fatigue and ME for more similar related information.